Hello everyone, and thank you for joining Every Moment is a Choice. My name is Erica Behel, and this is a podcast for people who are looking to understand their own unique courage. I talk with people who have inspired me with the choices they've made, both in their career and in their personal lives. Today, I am thrilled to have Dr. Laurie Charlés on the podcast. Hi, Laurie.
Hi, Erica. So great to see you.
So great to see you too. So for the listeners, Laurie is one of the world's leading experts on family therapy and mental health in conflict zones and violence-affected states. She has spent her career working in the field in over a dozen countries to scale up local family therapy programs for those affected by war and violence. A few of the examples, this is not a comprehensive list of some of the projects she's done, but she has worked in Burundi and the Democratic Republic of Congo, helping survivors of gender and sexual violence. She has supported World Health Organization efforts in Guinea during the Ebola outbreak of 2015. She has trained and supervised local psychotherapy practitioners and programs in places as diverse as Syria, Kosovo, Lebanon, Central African Republic, Cameroon, Libya, Sri Lanka, and Egypt. She's trained family therapy practitioners from over a dozen Asian countries on behalf of the United Nations. Laurie is also the recipient of not one, but two Fulbright Fellowship grants. During one of those, she created a grassroots toolkit for family therapy practitioners in transitional justice and reconciliation initiatives. She has numerous publications and books that she has published already on international family therapy in reconstruction and post-conflict areas. And I am so delighted to say that I met Laurie way back when we were in Peace Corps together in Togo, West Africa, over 20 years ago. It feels like it's... So we will get into Laurie's career, her various experiences, and some great stories. But before we get to all of that, I would like to dive right in because today's post-COVID world, all of our listeners are out there and we are talking and thinking about mental health so much more now than we used to be, especially pre-COVID, right? So we talk about mental health. It's a huge issue in the workplace, for leaders, in schools, even for our kids. And so, Laurie, I wanted to just dive right in and get your take on the situation with all of your expertise. Is that okay?
Yeah, sure. Thank you. Thank you so much. What an introduction. That's so great to be here, Erica, and great to talk to you. It's interesting for me to talk about COVID-19 because I worked in the Ebola virus disease outbreak. So I had the experience of, working with contact tracers. I had the experience of IPC, infection prevention and control. I was in West Africa, but I live in the United States. So at that time, people may remember in the US, there were one or two cases and they made the headlines every day. When I would return from my mission in Guinea to the US, I had somebody from the CDC waiting for me at the airport because I had come from an Ebola-affected country.
Wow.
And in the city I lived in, where I was based, this was in San Antonio, the health department had identified me as a risk. So I had to report for 3 weeks, my temperature twice a day. So I was not even exposed to Ebola when I was working in Guinea.
Yeah.
Ebola virus disease is the kind of disease that it's very obvious when you're sick. Or when someone is infected. And when I arrived there a year into the outbreak, the social and cultural mores were such that people understood how to protect themselves and protect other people. So to watch COVID-19 unfold in such a dramatic way was really powerful for me. I mean, in one way I felt very prepared. And my family was also very prepared because they had watched, what I had done. And after my work in Guinea, I made sure my family members all had the radar thermometers, and those came in very handy right later on. But and the work that I did in Guinea was focused on reducing the stigma of Ebola for affected family members and also for the staff that were affected. So it's very analogous to COVID. So how COVID, the diagnosis and the illness and the death from COVID affect people around them. So this was our focus also in Guinea, and particularly around like how do we support the trust that needs to be there between a community and public health providers, so that the transmission is reduced, and we're addressing the whole person. Not just the infection, right, which needs to, or the virus rather, needs to be addressed, but the repercussions of that on people's health. And that is also analogous to COVID. So for me to watch what happened in COVID, I mean, it was really clear what needed to be done, because we have examples of it across the globe, across other pandemics and epidemics, but a hard time managing the social component of how a community, trusts its health providers or trusts governance to tell them what's happening. And also the shock of having to think about the way that you wash your hands and what you breathe. It's kind of shock and awe for certain countries, but in other parts of the globe, not so much a shock. For instance, in Guinea, the contact tracers were community health workers who had been working in the polio like outbreaks. So it was like a ready-made cadre of people, whereas it was, not like that, obviously, in the United States. So in Guinea, we would say that there's no health without mental health, in French, right? Il n'y a pas santé mentale. And I think that idea has now become much more accepted across the globe because of COVID, like that we need to address mental health and all its permutations and all the ways that people need to be supported for their well-being.
Absolutely. And it seems, because it was such a global pandemic, and even in the Western world, right? Ebola affected places that were, for the average American, a very far away place. Ebola was kind of something that was very remote and didn't really touch the US. But yeah, the global nature of COVID has really brought it to the fore. So in terms of global mental health today, after, you have so much expertise on especially families, and you talked about individuals and then their overall families in terms of mental health. I wanted to ask you a question. How do you define family?
Oh, I love that question. I love that question because, for a few reasons. Like, one is that everywhere that I've worked, and I've worked as a family therapist with, many thousands of hours with families in the US, and I've trained folks who work with families. And I mean, it's universal that family is important. Like, there are always values about like the need to have strong families, and families should be at the top of our list when we think about what makes a strong community, right? But what's different is how people identify family, and also the things that people think families should do and not do, or how families should look and not look. So that's where things get, a little bit less universal. But my stock phrase is family, it can be kin and non-blood kin. So blood kin and non-blood kin. And literally, when I'm I'm a systemic family therapist. So if I'm working with one person, or we're talking about, someone who has a diagnosis of COVID or EVD, who are the affected people in that person's network?
Mm-hmm.
And, it may be direct family members in lots of parts of Africa. Non-blood kin is very important. I mean, there's not those kind of distinctions about like a sister is a direct sister from the same mother and father. So I think a lot of the world is like that. It's a very broad talking about what family is. So my stock official answer in a training will be like, blood kin and non-blood kin. And then how does the person I'm working with define it? That's almost more important than what I think. I mean, I think family is whoever we say it is, and in terms of the person I'm talking to. Does that make sense?
It makes sense. And I remember now from when we were in Togo together, someone would introduce a Togolese person would introduce their sister, and they would mention, oh, même père, même mère. And that means same mother, same father. They had to clarify that this was their sister by the actual same biological parents, because there was an extended definition of sister because of, husbands who had several wives, or they were kind of family groupings where they considered them sisters, but they weren't necessarily the Western definition or the American definition of sisters. So I remember that.
I forgot the phrase, but I remember being confused for me, my family is, historically from Latin America, right? So I have a very large extended family, but still having been raised and socialized in the United States to get to, Togo and struggle with, well, who's related to whom by whom? And that's not really the same question everywhere. It doesn't have the same resonance everywhere. And, even in the US now, we have the phrase where it says, a brother from another mother. Hello. Yeah. I mean, it's like, it's the idea of family is, I don't want to say it's changing, but it's unique. It's unique across places, and it should be. Why not?
And do you think, because when I originally hear the term family therapy, I think of the therapy that like divorced parents will attend with their children to get them through a divorce, or if there is abuse in a household and there's some type of kind of intervention with family therapy. But maybe that's too narrow a definition. I mean, when you talk about family therapy, what does that include?
Oh, that's such a good question. And I'm so glad you asked it. Well, so one important thing to say is that systemic family therapy is how I identify what I do. So in that umbrella, a family is seen as a system, but there are multiple kinds of systems, and there's all kinds of systemic theory and work in many fields. So that is the influence on the kind of on family therapy in the way that I was trained, and many people are trained. So that means anything that a person is experiencing that seems to be a threat or a challenge to their psychosocial well-being is up for grabs in terms of like, what can we do in terms of support or intervention? But you're right. I mean, I think traditionally there's this idea that that's the only time we talk to a family is when there's a divorce or when there's abuse, or, and it's not that that's not important to do. It's important to do. But quite frankly, the research shows that individuals do better in therapy when people in their family are involved in one way or another, because we don't experience challenges or like mental health problems or experiences in a vacuum. Someone else is always involved. Someone else is always involved. So a systemic approach is looking at, well, how do we incorporate, whether it doesn't have to be physically bring that person in the place, but like incorporate them in the conversation, in the dialogue, so that the individual I'm working with has a reduced anxiety or reduced stress, whatever it might be. So it's definitely broader, like you said, and it really can't be, I mean, divorce is not a problem everywhere in the same way, just like, même père, so the way families are constructed is different. And I like to think, that in the kind of work I do, that we're adaptable to whatever people bring in. So clients who have issues with work colleagues, that's a big challenge. Or, with the pandemic, clients who have challenges talking to their health providers, particularly people with like diabetes, chronic illness. And, I work in a community that has a large Cambodian population. So lots of survivors of the genocide in Cambodia. And, this is a very interesting type of work also. I mean, we're promoting the health of an individual means working with the family around access to care with their health providers and building trust, and also practical things that can reduce like their A1C, but also, with the human component. And that's so important. Like, so it's very holistic, and it's a long answer to your question, but I'm glad you asked it, because I think that's not a myth, but it's like it's an incomplete understanding.
Yeah. And I love your answer and your explanation around systemic family therapy and how we don't experience things, especially extreme traumatic things, in isolation. It's always as part of a whatever our grouping is, whether it's our blood relatives, whether it's our chosen family who we tend to rely on for support. And I think from all your experience working with people in kind of extreme situations, I mean, you've been involved in some pretty important conflicts, post-conflict areas and everything where there's probably a lot of trauma, or maybe I'm using the wrong term, but there seems to have been a lot of extreme pressures on people. And I want to actually get your take on trauma. There's a lot of talk, and another buzzword that I hear a lot is trauma. And so I want to kind of get your take on that. Was the whole COVID experience like a traumatic event for us as a people, or?
Wow, that's also a good question. I was talking with a colleague the other day, and she talked with me about how she and her coworkers in a training program, a graduate training program, are also discussing, is everybody traumatized, and what does that mean when there's trauma? And everybody has trauma. What is trauma then? And I do have the interesting experience, though, of working with people in places where, one thing that stands out is violence that people have witnessed directly, especially, or violence that people have been forced to become a part of with their loved ones. So this is one distinction that, of course, violence occurs everywhere in different kinds of ways, but one of the early distinctions I used to make was was it something that the person witnessed or experienced directly? And that's interesting because for two reasons for me. So I rely a lot on also Judith Herman's work. She wrote a great book about trauma. She's one of the original scholars, and she does a lovely job in her book about talking about how a traumatic incident can instill this feeling of helplessness that can linger for people. Mm-hmm. And that the antidote to that is in a way is activism. And so she names the Vietnam veterans movement and women's movement. The second thing that attached to that is what was the person's, it's not in spatial time, their closeness to the traumatic incident. Because that also became fluid in COVID. It's were we all on the front line? One of my colleagues and I asked, we were all, and in a way, yes. What is the number of deaths from COVID? And people still die from COVID every day. Mm-hmm. And death is traumatic. Death is traumatic. So to answer your question, I do think there is an element of a kind of post-traumatic stress that has blanketed the globe, and that I think we do, in ways that we don't quite understand yet, and we can't fully see yet, except that, I think the data will show in a few years how, people's health outcomes are today. And I know that lots of clients I work with now, the stressors they have around housing and inflation and food insecurity, and not necessarily violence, but conflict in their homes, have direct and indirect effects to COVID. And it's striking to me. Of course, it's going to be like that. Ebola continued, there is a vaccine now for Ebola. The outbreak was contained. More recent outbreaks have been contained. But we don't assume that there's no effects after that. There are. And how can COVID not be? COVID, of course. So I think there's a lot of positive outcomes that can come from dealing with extreme adversity. Mm-hmm. And I would say COVID had brought extreme adversity to many households. And so in those families and in those households, we have a lot to discover about how families adapted to adversity in ways that they didn't know they could. And that, of course, that happens, and this is something I've seen. This week is a 10-year anniversary of my first time working with Syrians. Mm-hmm. Since the war started in Syria. It's been 10 years. Yeah. And to watch them still do such amazing work. How it's overcoming, yes, there's incredible traumatic incidents, but there's also, I don't want to say resilience because it's another catchword, but there's also something else that happens. There's something else that can happen when people overcome that or continue to move forward in spite of that.
Yeah.
And so that's important to say. So are we all traumatized? Yes. Are we all here to find out how we can overcome trauma?
Yeah. So I'm fascinated by the kind of insight that you're bringing, that there's kind of a ripple effect. Like you're saying, there's the immediate kind of repercussions of events or violence or war or COVID, but then even years down the line, there may be after effects, kind of ripple effects as it moves through people's lives, how they deal with it and everything. I think that's so key, because what we're dealing with in 2023, we might still be dealing with some type of variation of post-COVID in 2025, 2027, several years down the road. That's so interesting. But you sound hopeful in that there is, like you talk about Syria, and 10 years on, call it resilience, call it some type of ability to move through these things, that I think is so amazing. And if you've learned one thing from, one positive, hopeful thing from all of your experiences, is it around that resilience? Is it something else? What would you say you've taken away?
Well, that's a big one. That's a big one. It's shocking to me to think that it has been 10 years. Mm-hmm. And, that the kind of work I do, it often involves a face-to-face component with people in their home country or in a nearby country where they're from. And then the rest of the post of that experience, is virtual through meetings online or texting, through encrypted, it's continued contact. And we're at 10 years now. And serious, not the only place that has happened. I worked for many years in Kosovo. I'm still close colleagues with these people that I met there in 1999. A long time ago, 2009, pardon me.
Yeah.
And there is something it's not just that they move through it, and they do, but like they move through it with like power and like creativity, and like they make the kind of family therapy I do seem outdated. They like create new stuff. And that is, so like one thing that sticks lately is like the future for me, the future of our field is going to look, because I've got this view from, what I've seen across low and middle income countries and countries that are, not part of, the global north, right? Mm-hmm. They create something different with the same ideas. And that's really inspiring. It keeps me curious. And in a way, it's like, I say like every new family I work with or every client I work with, it's like the first client, even though I have all these years and years of experience, it's always new. So it's something like that has happened with the work that former trainees of mine in conflict states have created in their context, which I do not live in, where I do not speak the language. So of course it's going to be different, but like to hear what they're doing and see some of their things online, it's like, wow. It's like, yeah, I feel like I know a little bit more, but even if I didn't know anything, it would blow my mind what they're doing. So.
Yeah. And that's so hopeful to me. Something that reminds me of that concept of people working in the community, taking the knowledge, applying it to their situation in a way that is relevant, local, culturally appropriate, and everything. Sounds exactly what almost development work should be. And it takes me back to Peace Corps, because you and I were both Peace Corps volunteers, and I don't want to upset any Peace Corps people, but looking back on it, it looked more like a program to develop young Americans with a wider worldview, to develop leadership skills, rather than to actually impact communities, right? And you come in most Peace Corps volunteers are quite young. We were in our 20s and everything, going out there, having fun and doing, quote unquote development work or projects and everything. And I think what you're saying is kind of like the more impactful version where it's not Laurie Charlés, Dr. Laurie Charlés, who has created all this impact in Kosovo. It's the people that you've trained who are doing it, and they're still doing it right now. So many years later, that's still impacting, and that seems like appropriate type of development work.
Yeah, the longevity. And I mean, we have this saying in, that's in therapy or in family therapy. I mean, you kind of, your goal is to kind of get fired. Your goal is to not be necessary anymore. Yeah, I don't really, it's not like you want the family to fire you, but you don't want to be needed. I mean, the goal is that's how I was trained, and I believe that. And I think it's very similar in international work. I don't want to be needed. And I don't, what's interesting too is the lots of groups I work with, because they might be new, at some point they're new to the content of what it means to work with families. It's hard for them to see a period where they don't, where they're doing it on their own. But it always comes. It always comes. I mean, I love in Kosovo, like the last visit, my last Fulbright was the last time I was there. And, I'm going to like the clinics that people have opened up. They've opened up family therapy clinics, and one of them, they did a conference on trauma in war. And it was the first time they heard that they'd had a conference in Pristina on that. And I don't know, hundreds and hundreds of people came. So this is like, wow, yeah, it's exactly how it should be. It should just roll right forward. And then it's easy to take a step back. I mean, literally, I'm not in the place. So like, I'm not there.
Yeah.
But I think that is harder, that this idea of development, like we don't know what to do necessarily after. Like how do we follow something? In this case, for me, I mean, the relationships that develop, that's what sustained it. The relationships I have with my colleagues in Sri Lanka and Kosovo and Syria, our lives have changed over. I mean, their lives changed, but mine does too. Their country situation changes and mine does too. But it's powerful to me how some things remain the same. So like the need to support families in the settings where they live, in spite of the dynamic changes happening, that stays the same. So that's fascinating for me to watch. Like, oh, how did they support people? They had the war, they had COVID, and then they had the earthquake.
Yeah.
So like, yeah. And, that brings me like, it makes me stay on my toes, which is good. It's good because I've been doing this work a long time. So anything I can do that keeps me fresh and keeps me on my toes is like a good thing.
Yeah, definitely. Well, how empowering is that message, that you see the fruits of what you've done live on and just blossom in the local communities. That's so awesome. I love that. And you mentioned, I want to hear a little bit more about your own story and how you got into this line of work, because when I met you, it was in Peace Corps, but at that time you had already done your doctorate and you had freshly finished your dissertation, I think, when you left for Peace Corps in family therapy. So what led you to family therapy in the first place?
Well, I realized pretty quickly after I got my degree, I got a liberal arts degree in psychology, that I couldn't do much with it. Like I needed more, I needed something else. And back to relationships, right? I was introduced to the faculty in the program I went to, Our Lady of Lake University in San Antonio. And, they hooked me. They hooked me in the way they talked about families. And then, I had my first class. I still remember the role play that my professor did at the time, and the power of like how that affected me. And, I was hooked. I worked throughout my graduate degree, my first one. So I spent like 6 years doing that master's degree. So I was like really immersed, and I still didn't feel finished. So I went on and got my doctorate. But I don't know. I think something about the curiosity of like change happening in the family was really powerful, and still is. And I don't know that I thought more broadly than that. And I certainly didn't know that I would end up doing what I'm doing now. Although my advisor at the time And my advisor in undergrad talked with me, and I remember her telling me, you're going to be in the Foreign Service someday. And of course, I'm not in the Foreign Service, but she was onto something, like this interest in the world and being curious about the world and wanting to be engaged in the world. That has stayed steady. And Peace Corps was part of that. I had actually, I had postponed going into the Peace Corps 10 years or something earlier, 5 to 10 years earlier, because of the finishing my degree. So I was also I'm like, I need to do it now or I'm never going to do it.
Yeah.
Because I was expected to join the academy and become a professor.
Yeah.
And, my advisors were a little bit, one of them was kind of horrified. Well, how can you join the Peace Corps? Of course, he's Canadian. So I always thought like, well, you don't know, Doug, that's what this is about. But that was part of it, is like, I need a break. And I had studied French in school, but I couldn't speak it fluently. So I'm like, let me do a Francophone place and I wanted to be someplace where I didn't know anything, where I had to really grow in all kinds of different ways. And that happened. It definitely happened. Yeah. Actually, when I talk about Peace Corps, I always tell people, it's funny that you mentioned this earlier, that I always tell people, well, I was like 10 years older than all my cohort in Peace Corps. And I that somehow, I loved it. I loved the contrast of people's experiences. And I really loved the program that we were a part of. It still has stuck with me, working with young women. And that, remember Hillary Clinton used to talk about her speech in Beijing, how that had informed what we did. And it's still so relevant.
Yeah.
I think that this is just like the work I'm doing today is a long line of that. One thing I'd add that is interesting in hindsight now, I work a lot in conflict affected spaces where there's ongoing combat or a history of conflict, separatist conflict, or low intensity conflict, all kinds of ways, right, that there can be violence between state actors and non-state actors. My dissertation was on a crisis negotiation. Mm-hmm. I studied, it actually happened to be a school shooting before school shootings were so common. Mm-hmm. But it was a large-scale critical incident, and I studied how it was resolved peacefully. Mm-hmm. And it's interesting to think now about what I do, because I also have worked as a crisis clinician, in crisis settings. So, I think sometimes I'm doing the same thing, but it's just a larger scale, or training people who work in crisis settings. We don't call them crisis settings, but the idea of there's extreme adversity happening in real time. So how do we support people? So that's, I didn't catch that till about 5 years ago. I'm like, because my dissertation, it was kind of unusual to do something like that as a family therapist. But, I was interested in how the crisis was resolved. To me, that's so simple. And I learned a lot.
Yeah. And it seems particularly relevant now in hindsight, and the type of situations and kind of environments that you've practiced your family therapy and family therapy training for host country nationals in those type of areas. So yeah, it's funny you bringing that up, because I remember, so for our listeners, the program that Laurie and I were in Peace Corps in Togo was called Girls Education and Empowerment. And it was a relatively new program. I think we were the first batch. Back in 1999 in Togo. And it was kind of a broad program. So we had lots of different activities within that, but it was looking at the inequity, the way that girls, especially school-age going girls in these countries, were often dropping out of school, ways to intervene, ways to kind of build up their confidence, to work with the community, to, essentially try to keep the girls in school. But also to work with women's empowerment as well. So it was a very interesting program. And I think that now, I'm not sure it still exists or whether it's kind of been incorporated in lots of the other programs in terms of gender equity. So interesting. So you did Peace Corps. You finished your doctorate in family therapy. You went to Peace Corps. Did Peace Corps kind of evolve your thinking on, okay, now I want to go lots of places and do this, and now I want to study more? Because then you went on to get another degree later, in your career. Like, how did it evolve post Peace Corps? Did you think you're going to stay?
Well, that's it. There is a good story there too. I mean, the short answer is no. I didn't think beyond. I don't know. I had a realization too. I'm like, oh, I came back. I just got my PhD, and I need to get a teaching job. And I spent a lot of years becoming, and I think too in hindsight, that's really important that I did that, like becoming sort of credentialed and established as a scholar and a teacher. And I focused on that for the next decade. But the first year rather, post Peace Corps. So we finished like 2001.
Yeah.
In 2002, I was working as a faculty in a state in the South, and I was so frustrated being land-bound in the United States. I was really frustrated, and I was desperate actually. And I've told the story just a few times, but I wrote an email, a cold call version of an email to a senior scholar in our field whose article I had read about his work teaching family therapy in Indonesia. And that article really had an effect on me. And I was so desperate. I got his email, I wrote him, and I'm like, can I go to Indonesia? I just flat out asked him. Now, he wasn't even from Indonesia. That's how desperate I was. But I asked him for help. And I ended up, I ended up going to the Philippines the first time that summer. So there was something that happened post Peace Corps that I couldn't shut off. The impulse to be placed in an area where I was new or didn't know everything and had to learn new things. And what had changed was I had the teaching experience. So I went to Manila and I taught for 3 months at Del Sal in Manila. And Fred Piercy, the person I had written, he's a good friend now. We wrote an article about that afterward. He didn't know me, but he still helped me. He wrote people and he said in the email, I don't know her, but which I thought was so honest. I really respect that he did that, because now, of course, I'm in the position where people ask me that stuff.
Yep.
So, and I went to Manila again. I served on a board there. But I think you're right. And I hadn't thought of it about that way before. I mean, I stayed on this traditional path that I needed to do in my field that had been laid out for me, right? But then I was like, I have to keep this other thread going. So I went to Manila. I went to a few years after that. I went to my first Francophone country to work as a consultant. And then I learned that, and someone actually told me, when we see that you've been in Peace Corps, we can see that you can parachute into a place, and especially a low resource setting, where and you learn French, that was like a big, and I didn't expect that. It was a big draw. So yeah. I found myself wow, really lucky that I had that experience in Peace Corps. I didn't expect that.
Yeah. And how important is it to reach out to people, because you never know. I've reached out to people thinking they're never going to write me back. They're too famous. They're too important in their field. They're never going to write me back. Sometimes they write you back. Yeah. Sometimes they help you out, right?
Yes. No, I agree. And he was a role model for a long time in that way for me, where, I just being available and accessible, especially I think sometimes the kind of work that I do, or this kind of work, it can seem very inaccessible. Who knows what's going on in Syria? How would you learn that? And, there's, or Kosovo. I mean, and that is also, I feel like I have not exactly, kind of a responsibility. I need to speak to that. I don't want it to just be a one-off. I want people to know. So anyone who writes me an email, especially if it's someone I know that has referred them to me, I'll respond. And that's easy to do, to talk to people. It's easy to do. So
Yeah. And so important. So you said you still had that kind of itch to scratch with international settings and everything. What prompted you to go on and you got another degree in international relations a few years after that?
yes.
What prompted that?
Oh, yeah, I forgot about that last one. Like I have, yeah. And that whole time, by the way, has been 10 years, just like accidentally. But I was really frustrated in a professional like situation in a region of Africa where I applied to the program. I had applied to the program at Fletcher where for mid-career professionals, but I put it on. I deferred it.
Mm-hmm.
I was working as an academic in the field of family therapy, and I just thought, oh, this might be interesting. I went to visit it, and so I applied, was accepted, but I didn't go right away. And that changed after I had an experience on a consultancy job where multiple countries were involved, and there was exploitation happening on the ground with the group I was working with. There wasn't any type of communication or coordination between the multiple countries that were involved. The funding stream seemed to be influencing the corruption that was happening and unethical things that were happening. And that experience, I remember having lunch with my husband, and he was with me, and I'm like, it's time to go to Fletcher, because I knew what was happening, but I didn't know what to do. And I'm like, I don't know what to do. And it wasn't enough for me. The family therapy background wasn't enough to manage this kind of complexity. And I started Fletcher like 3 months later.
Yeah.
And that it made a huge difference for me in my, the scope of knowledge, certainly, but understanding how the international system works and how it doesn't work, what I was doing seemed so interesting and wonderful, but I remember being very curious why I could do something, in one country and it was only for 2 weeks, and yet another country I could be there for 3 months. How did that get decided, and why did that matter that it was different? And why couldn't it be the opposite? So, and I didn't know how to answer those questions. Now I can answer those questions. So that was important to me, like to understand it. And I didn't necessarily the way I approached the work changed after that. It's not like I necessarily got more work, but the way I approached it changed. And I also developed,
How did it change? How did it impact?
Well, I got a lot more selective about how I chose what I did. And I got a lot more focused on, like, I knew to pay attention, especially for, projects where there's, international funders, and there always are international funders, right? And these multilateral projects with multiple organizations involved in countries. And that's important, and everyone has a role to play. But for me, having a good understanding of who was in the community on the ground, like who was actually doing it, who was it? Yeah. Now, the work I do, and also it's like post-COVID, I don't have the luxury to be on the ground to meet those people. But I want to understand like what that looks like. And in my work as a family therapist, because the other thing I've noticed is that everybody wants to be able to say they support families, but not everybody knows how to do it.
Yeah.
Or they do it in ways that are not helpful or not evidence-based, right? So this is a real risk in our work, because people really want to support families, and organizations really want to say they're doing it, and it's an important declaration to make. So I want to see what's behind that. Like, is there support? And what is the support? Is it beyond the financial support? Like, are they committed to the sustainability, right? I learned the definition of sustainability at Fletcher. And like, I always quote that when I write about a project being sustainable, like they need to be able to do the work without me. Am I doing it in such a way that they can do it without me? And so I think I approached it in a more, in a less romantic way, quite frankly, less romanticized.
I was about to say that because I think for people who are not directly involved in things like development work, it can seem to be kind of almost altruistic. Like we're donating, we're helping, we're doing all kinds of great things for people who need us. And Peace Corps is just one kind of agency that does that. But there's so many multilateral agencies who are involved all around the world. And you quickly see, there's agendas behind things. Sometimes there's motivations behind decisions or funding decisions and all that kind of stuff. And so it is kind of, it is kind of a bit of a slap in the face almost, or a bit of a shock for some people to realize that there's corruption, there's politics going on.
Yeah, there's salary.
even in these organizations, right? So you definitely learn to be more selective and understand the context of how you're working, is what I'm hearing.
Yeah, definitely. And, I went through a phase, especially with certain countries, where I would return and, the people who called me brave versus the people that didn't, that doesn't fit well for me at all. I'm not brave. I mean, this is work. I get paid. They're jobs. Mm-hmm. They're just like any job that anyone else might do. Mm-hmm. Like you said, that where there can be a risk that you have to manage. There's corruption that you have to mitigate. Mm-hmm. There's people who have strengths and people who have less strengths in the area that, it's just like any other place. But something about the passport or the border or the language where it quickly becomes exoticized or romanticized. And I talk about this a lot with some of my colleagues because it's frustrating. It's frustrating, but I don't let it get to me. Like, okay, that's one audience. Like I live outside. I live in Massachusetts. So I'm on the East Coast, and I often think here's my audience here, and then my audience is the rest of the world.
Yeah.
Look at the Janice face, right? And international. Yeah. So can I look both ways? That's okay. And gosh, the Fletcher degree, yeah, it was really helpful. The coursework was so helpful. The sensibility I developed was helpful. And again, like Peace Corps, boy, the friendships I've made, because their work, the cohort was already doing international work. They were mid-career professionals in intelligence and diplomacy and finance. They had an in-depth understanding that I have drawn on again and again since then.
Yeah,
in the work that I do, that has very, the complexities of doing multilateral consultancy work in family therapy, which is like a knowledge transfer. I mean, it's so important to have that network. I'm sure you have it. You have it too, right?
I think it's what sustains you sometimes, especially if you face rejection, if you all of a sudden lose your funding for something because of circumstances completely outside your control, if you lose a job, for things outside your control, who do you go to? Yeah. Those friendships and that network really sustain you, almost like a family.
Yeah, very much so. Yeah. Yeah. How about that?
So, in terms of, we talked about some of the kind of things you've realized along the way, what motivates you to stay the course, to continue this type of work? I mean, it must be difficult. It must be mentally, I'm just guessing here. If I was doing this type of work, I think I would be mentally exhausted sometimes. How do you, replenish your own stores of energy?
I mean, it's changed over the years. There was one period where, I really love to run. I don't run as much anymore because I had an injury a while back. So I'm still trying to get back up to it, but running, and one project, I doubled my run time which was I wasn't running that much, but my double time was 9 miles. I'd watch a whole movie if I was indoors, a whole movie while running.
Wow.
Now I know, now I'm that was crazy, but that's what that's what happened for me to manage that particular project. I used to get massages once in a while, but during that project, I did it every week. And that, it was like not even to just do better. It was just to stay normal, actually. Now, it doesn't have to be as intense. And I've noticed if the work is intense, like the efforts to balance need to be also to match it. Like I need to match it in proportion. So, exercise, obviously, but I get bored easily. So and now I live on the East Coast. I'm like, I can't always run outdoors. I sprained my ankles. I'm like, oh, now what am I going to do? So I'm always looking for something new, like a physical activity. Mm-hmm. I also try to do something intellectual that's not in the work I'm doing, because I don't know, something about it occupying my brain. So I've been learning Arabic for also 5 or 6 years. So there's something about turning a switch that helps. Some things I can't do, like when the work is so intense. I notice I have to sleep more, obviously. Mm-hmm. And I used to love to read, but now reading is not. I need to do something physical, something that's more. Yeah, but you're right. It's and I only work about, if I look back, it's about 3 contracts a year, which is not very many, but it's ongoing. So it feels like it's the whole year. And I'm working with a group right now, and this is my 8th month on their contract. So I need to develop the stamina. I have the intellectual stamina to do it, but figuring out the physical stamina plan is important. Important for me, or else I can't do it. I can't do it. And my doctor remembers the time. This was during one of the more stressful periods. I developed a bad habit. I started smoking, which I'm not a smoker. And, it lasted 9 months. It lasted exactly 9 months. And then I just stopped. And now I'm I can't even believe that I did that. But at the time it was a poor coping mechanism. But, nevertheless, it's interesting to see what pulls me in what direction to deal with something unexpected. And, that happens a lot. It happens a lot. Friendships help. So I'll text a friend, especially one of my Fletcher buddies, and that helps ground me again. I was going to say, that's also important because the work I do, it's not that it's secret, but I can't always talk about it openly. So I need to be able to connect in a way that someone can respect that, but also get it.
Yeah. I hate to admit, I started smoking too in Peace Corps.
That was my last cigarette. Was it pure? You don't still smoke, do you?
No. I quit. I thank God I quit. But something about Peace Corps.
Yeah. Well, we used to always say that Togo was the hardest. It was the hardest country, but I don't know. I smoked too in Peace Corps. Yeah. So there, the coping. I'm human too, right? It's what's good habits and bad habits. I have to have a good relationship with my PCP, my doctor, because of the work I do. I need, I often need fitness for duty, and I need his advice and guidance about this or that. So when he has a good record of giving me good suggestions that work. And so when he told me, he's like, are you really smoking? Do you realize X, Y, and Z? And I'm like, oh no. Okay.
Yeah. So there's unhealthy coping, and then there's healthy coping, or healthy habits that are able to bring us out of those. Nice. So what are you looking forward to doing next? What are you excited about?
Gosh, well, professionally, every project is new and different, and that's always wonderful. I never know when. I don't think I'm ever sure until I see an actual contract, but what I'm going to do next. But something has happened with the most recent work, in that not only is it multilateral, so that was a big change. It used to be just one country, mine, and then where I went. But now it's multiple countries. And that it also used to be that I would go to a place, and that's how things start, with a face-to-face training. And then there's people that I support or that are supporting others that's developed over time. But now I'm doing this thing where it's the model's kind of flipped, where I'm supporting specialized advisors, mental health advisors for a large organization, who are supporting what we call focal points. So points of contact in 20 countries.
Wow.
those focal points are supporting multiple staff members in multiple regions of each of those 20 countries.
Wow.
So I'm expending like extended time with this small group of advisors, and essentially training them, preparing them, supervising them with the technical expertise that they can continue this in a sustainable way. And I conceivably, I will never meet any of the people that they're supporting. So that's interesting. It's like somehow it's flipped. And I do think that something like that is the future. That's certainly what global mental health is about. Like, how can we reduce disparities in ways that are sustainable for and appropriate to country context, not just culture. Culture is important, but culture and country context. And in low and middle income countries, we have to be creative in how we think about doing that while also using the evidence. So the support I'm giving to this small group, really hinges on these like evidence-based interventions that are teachable and implementable and that work. Now that's it. I went to school for 12 years to get my family therapy degree, 12 years. So like that's the contrast to like what that looks like on the other side of the Janus face is fascinating, raises lots of interesting questions. But my interest is like, well, how, I just want to keep doing more of that. And I'm at the level now, I really want to support other people in my field to do more of that. Mentor them, help them find opportunities, help them develop their experience and skill set. And I'm kind of focused on that now. I do a lot of it informally, but I try to, find avenues where more of that can happen. I always think the last contract I had, like, who knows when I'll get a next one. And then the next one shows up, like, okay. And it's like an email or a note on LinkedIn or something. And then we have a chat and here we are in the midst of 6 months later, 8 months later. And that's very humbling. It's like, wow. There's something about it's not without purpose, but I don't, things come, and that's kind of nice. So it doesn't feel stressful. It feels nice. It feels good.
But things coming means there's still conflict out there that requires your services. The world is not changing in terms of reduction of conflict. There's Ukraine, there's so much going on right now that it seems like you're never going to run out of demand for mental health.
Back to the thing we started with, the COVID. We're all still living in that post-COVID world. So, the earthquake on top of COVID and the Ukrainian war on top of COVID, on top of the earthquake. What is different, it feels like more solid or more like it feels like that's something purposeful, is that it's clearer now at the international level how family therapy can work. It's clearer, like how it can work and how we can implement a skill set that will reduce mental health disparities and improve outcomes for individuals and families. And now there's like really clear, like declarative interest in family systems expertise. And that's very exciting. But, I'm I'm not at the beginning. So for me, it's a different kind of exciting. I'm like, okay, they're ready. We were at the table, but now I have to see how to bring more of my U.S. Western-based colleagues. We have so many programs in the United States, and family therapy emerging scholars they're not all U.S. citizens, and they're not all born and raised in the U.S. It's very international. So we need to match like the demographic of the student and the emerging scholar with the demographic of this need that's international across the globe. And we haven't done that well. We're still it's still very traditional in my view. So that kind of inspires me. I'm inspired by being frustrated, actually, Erica. So when I get frustrated about something, I'm like, it makes me, I'll go and like write a book, write an article, or, do something, try and do something. So that's like also like a Herman, I think, Judith Herman's ideas, like action is a helpful way.
Yeah. Well, frustration breeds, solutions. If you are willing to investigate something and be frustrated by something, then that's why the creative juices start flowing and the intellectual juices start flowing to solve problems. So I love that, actually. One thing that I really like that you mentioned was, and we had talked about it a bit earlier in the discussion, is that having an impact in the world is not necessarily how many people you are individually touching. But I love the kind of model you can build around you're training certain people. Each of those people goes and trains 10 more people, who trains 20 more people, who impacts 50 more people. And that's how do you scale your impact? It's really through others, right? It's not always about ourselves.
Yes.
I love that.
I love that way you put that. Absolutely. Absolutely. Yeah. I mean, and it's almost really never about me. It maybe starts with me. There's a pinpoint where something happened, on June 14th in Beirut.
Laurie gets frustrated about something. And then all of a sudden 10,000 people are getting trained.
Yeah. Like that. Yeah. Yeah. I can stage left. Go learn Arabic or something.
Yeah. I tried to ask this question whenever I talk to a guest. What do you want to be remembered for?
Yeah, I saw that. Oh my gosh, I saw that question, and one of your other guests. That's such a hard question to answer. I don't think about it in the moment, but I've thought of. I mean, it comes to mind after I've heard something from somebody, and I'm like, oh, I like that, or I didn't think that mattered to me, but that matters to me. So, like, for example, I had one person after a training, and this was a person who was a little bit more senior in the training group, so also a little bit more, not quite adversarial with me in the training group, but less receptive, more seasoned, more skeptical, perhaps, which is I kind of also find refreshing because the people are so excited about family therapy, they can't see where there might be a flaw or a challenge, and this person saw. But at the end of the training, he gave me this beautiful compliment. I had to go look it up on Google because I'd never heard of it. He said something like, you're like the blue ocean. You're the way that you train is like the blue ocean or the blue water. And I didn't know what he meant. It was a deep compliment. I went and looked it up, and it's some concept around fluidity and adaptability in the training. And now this struck me because of the way he had been in the training, and I didn't know him. And I've heard other things like that languaged in other ways that resonated the way that he put it. And when I'm engaged with somebody, whether it's a client family or it's a training group or a colleague whose work I'm supporting because they're supporting other people in this part of the globe, there's something about the human connection that happens. And when I'm training, there's something about that it's natural for me. Like, I don't notice that I'm doing it. I don't notice it as effortful. Like, I'm focused on a skill set, but I have to, to get that skill set to happen, I have to orchestrate a role play. To orchestrate a role play, I have to have my interpreter on board with me, or sometimes two interpreters. I have to also have orchestrated and managed and enriched the safety in the room between the people present, which is not a given because of the nature of the experiences that are happening where they live. And those things are also natural for me. And I think it's maybe my experience working with families, like everybody's, nobody agrees on anything. But that's how you start. It's like, okay, we can at least agree that we don't agree on anything. You start with what's in front of you. And so something about that, I don't even know really what it is. And that's why I think it's kind of nice to be remembered by it. Like, something that I'm doing resonates in a way that I still can't explain, and it doesn't feel like work. So that's something I like, that I'm like, okay, I can live with that. I can live and die with that legacy. And, maybe in 20 years, these people I'm training now who are training 20 and 20 and 20 others will be able to say, what happened there was that's how we did this.
Yeah.
I mean, yeah. So, I mean, even like today, I mentioned to you that role play that I watched when I was a master's student.
Yeah.
And see, that is a legacy that professor left for me. It's just a simple role play.
Oh, that's so beautiful.
I mean, isn't that, yeah. So
yeah,
I'll be okay with that. I'll be okay
that
with
is
that.
awesome. That is awesome. It's so beautiful to think 20 years from now, there's going to be somebody in one of these far-flung countries that said, I remember that role play.
Yeah.
Oh, it's going to be so beautiful.
Yeah. Simple too, I think,
Yeah.
I think it's also important to be nice to people. And I'd like to be like kindness. And I have seen a lot of that not happening in places where people's the agenda or the just lots of reasons and ways that things can get unpleasant, to put it mildly, and how much kindness matters. Like in every situation, how much kindness matters, even when it's hard. Like, how do I do this in a way? I mean, and it's kind of a diplomacy, diplomacy of kindness, because you never know what's going to happen in a place, and you never know. And you always have to act in a way that that whatever you have imprint you leave can continue. So that changes like the nature of how you behave. And it's not like I'm an unkind person or not a nice person, but I didn't used to think it was important. And I would say it's important. So I would add that to the thing. Oh, she's nice. She's nice.
Absolutely. Absolutely. Wow. I'm just I'm trying to process what I'm feeling after this conversation. I'm feeling very inspired in a way, because I think lots of people a lot of people are reassessing their careers, reassessing their situations, like we said, post-COVID and everything. And for people who want to have an impact, I really think that concept of kind of propagating your impact across people so that they can take it and propagate it as well and remember you for that is such a key fulfilling kind of concept for how you can view your career. So I'm really taking that away from this conversation, and just the memories, the Togo memories are so fun. And we didn't even talk about all the juicy stuff.
We didn't even talk about them. our bike rides and our village meetups right before it got dark.
Absolutely.
Yeah.
So if any of our listeners are interested, you are on LinkedIn.
Yes.
Do you have a website or anything that I can link people to?
I don't have a personal website, but there's a project I did with a colleague at the start of the pandemic where we created a website with a number of different pieces on it. It's globalfamilysystems.com.
Perfect. I will put links to those in the description as well, so people can reach out. I just want to say thank you so much, Laurie. It's been an amazing discussion.
Oh, I've loved talking to you. So great to be here. Thank you so much for the conversation.
Thanks.